sure to keep the caption window open if you use it, and also keep the Zoom meeting open. If you have questions throughout today's events, please include those in the questions and answers function at the bottom of your Zoom panel. We'll answer the questions at the end of each session. And I'll now turn it over to Alicia Branch, our One Lab Network lead, to introduce our next speakers. Alicia.
Thank you, Blanche. I'm thrilled to introduce this dynamic duo, Commander Sabrina DeVos. Sabrina is a team lead for the Biosafety Core Team in the Quality and Safety System Branch, or QSSB, and the Division of Laboratory Systems here at CDC. She has combined experience in biorisk management, regulatory compliance, emergency preparedness, and program management. As team lead, Commander DeVos provides technical expertise and guidance in biorisk management and clinical and technical expertise to biorisk management to clinical and public health laboratories. She is responsible for delivering high-level oversight and coordinating clinical laboratory policies and operations associated with laboratory safety. Dr. Diego Aramburu is a quality team lead for the Quality and Safety Systems Branch in the Division of Laboratory Systems here at CDC. He leads the Next Generation Sequence Quality Initiative, a collaboration between CDC, APHL, and partner state and local public health laboratories to develop a sequencing-specific quality management system. Diego works to improve the quality of laboratory testing and clinical and public health laboratory settings, focusing on quality management for molecular assays. Our next speakers are Dr. Diego Aramburu and Commander Sabrina DeVos.
So I just want to thank the conveners and for giving Sabrina and I an opportunity to present on both quality management, quality practices, as well as risk management in laboratories. Do want to call out that Sabrina is in the Division of Laboratory Systems, is now our acting deputy branch chief, thus speaking further to her ability to provide guidance and insights. Just want to briefly touch on the Division of Laboratory Systems, which is in the first center at CDC to focus on the laboratories and laboratory systems. So DLS works to improve laboratories in both public health and clinical settings, and the systems that support laboratories throughout the whole testing cycle. It works to improve not only clinical care and public health, but has activities touching emergency response and a number of activities regarding health equity and the utilization of laboratory systems for the improvement of health equity. I just want to highlight kind of what we're going to go over today. I'll start over with quality management systems, quality practices. Then Supreme Commander DeVos will go ahead and take over and talk about the intersection between quality and risk management, and then delve further into risk management assessments and close this out. So I had an advisor who'd kind of love to pontificate on their role for spewing copious amounts of information, and then hopefully within the nuggets of knowledge that everybody can use. So I will absolutely adopt that, and that I don't think anyone on this call is unfamiliar with quality and quality practices, particularly in a laboratory setting. And hopefully in this overview and kind of a bits of deep diving, there will be a nugget of knowledge that everyone can take away. So while perhaps it sounds ephemeral, but this concept of what is quality, right? What does it mean to everybody, and the diversity of what it means to laboratories. Now, according to the American Society for Quality, it's a subjective term, and each person or sector has its own definition. So, for example, the quality in your laboratory might mean that test results, you're focusing on the test results, they're accurate, reliable, timely. Furthermore, it could also mean that your laboratory products and services are in compliance with specifications, regulations, and ultimately meet customer needs, whoever those customers might be, and expectations. So there is no one approach to quality, right? And it's not informal, and I say that purposely because when we start talking about quality policies, quality practices, buy-in, on an institutional level, it matters what it means to be what quality means, and that ability to kind of garner buy-in matters. And so, again, laboratories, without question, need to produce dependable testing, accurate results that are reproducible, repeatable, in a timely manner, always with this specter of limited resources. Right? I think it would be um, absolutely great, although perhaps a bit of a fancy, if every laboratory had all the staffing and funding that it requires. So I think this ability to be cognizant of what we use our resources on is a very real thing. Now, the complexity, and I think someone would argue that the ever increasing complexity of laboratory testing requires more of this systematic approach to ensure not only the accuracy, but the reliability, and increasingly the utility of those test results and services. So controls and assurance of quality should extend beyond individual metrics. Extraction controls absolutely required, but should not be, and I don't think in common practice is the end all. So now a quality management system, which we're going to be approaching here, is that systematic approach to describing, documenting, implementing continual improvement, that measuring, and then that monitoring, that testing monitoring of operations. Now, process and procedures are purposely designed and guided by continual improvement, or is this idea of how do we make it better? How to respond not only to emergencies, but ever-changing climates, supply chains, for example. They do need to meet and be customized towards institutional situations, regulations, but also other regulatory or accreditation requirements. Ensuring quality in laboratories requires a process-driven and systematic approach to manage all laboratory activities, and we'll get into what all those activities perhaps might mean. And then this planned and systematic approach helps ensure that laboratory results are accurate and reproducible. And then quality management is used to actively manage, again, all those activities and the extent possible organizational related organizational functions, facilities, for example, purchasing. And we will note on sometimes there's instances where things should not be managed, and then how those impact the laboratory system as a whole. So again, I don't think this slide is surprising at all. And I'm not going to go through it in its entirety, but really I just want to focus on this evolution, this natural evolution I think that has occurred, where we look at quality control of a particular method. Method validations really come to mind, but we move up from methods, modalities really, to more of processes, how laboratories are formed and function, to also then that ever increasing laboratory system, all those interacting. Again, tests don't run, even increasing automation tests don't run themselves yet. And so those personnel, those competencies always consideration. And then as was mentioned earlier today, and I'm sure in previous days, those retention and training and then buy-in, specialization of the personnel performing those tests. Oftentimes quality control, and not always, but there's some limitations in the total testing process from receipt, excisioning to resulting. What are they controlling for? The reality of the situation is, quality control metrics are required, but oftentimes it can be challenging to control for every iteration and every step. So as we move towards that assessing of processes, we start to get into those pre and post analytic errors. And then again, as we move from control to assurance to management, we then again start taking that step back and looking at those systematic and wide focus that's broader than assurance, that's broader than quality controls, and to look at the processes themselves from end to end, but also how those processes integrate into other laboratory functions. And then again, how do those laboratory functions integrate into public health laboratories, into clinical laboratories, into hospital systems? So this is, I think we're going to go ahead and open the Q&A, but regardless, this is, I think, just of a pre and post situation. What is your perceived status of quality practices in the laboratory? We've talked about quality controls, or a particular method or modality. And we take that higher step into the assurance of the end-to-end processes to really look that they're fully developed, monitored, and are effective when we start thinking about non-compliance. But then again, that is your laboratory already there, that the quality management system is complete, it's set up, it considers all these aspects, it has buy-ins from key partners at all levels, whether that's a director or the laboratory of the institution or of the laboratory. Or it's just, I always like to inject a little bit of levity. What is quality? What is it? What is quality? So when we start thinking about, again, those quality management systems, we've already been talking about. There's this idea of, oh, perhaps I went ahead too fast. Maybe I'll just pause because I see that the poll results are coming in. But as you're going through this and completing that poll, when we start talking about quality control and quality assurance, these ever increasing overlapping concentric circles, we really think about quality management system as formalized, agreed upon, and documented. Everything we do has to be documented, but again, are all the peripherals documented as well, and all aspects of operation. And Sabrina will speak to this more. Things like risk assessments really start to come into mind as to what is the assessment, what are the potential breakpoints, what are the failure points? Is it middleware, right? Are we having an issue with middleware? We can't transmute information. Is it more so that we're onboarding new analysts? What are the opportunities there? And it's just that. It's when we look at a systematic approach, it's these opportunities to identify improvements and then implement those changes effectively, so that the personnel performing the test and then approving the test, and then those approving the facility, perhaps directing the facility, all have buy-in and agreement. So when we talk about actively managing all laboratory activities, that is to the extent possible. Because there are, of course, limitations, organizational limitations, fiduciary limitations, but we do recognize the laboratory science and therefore the systems are then impacted. And we always like to say, and it is extremely unlikely that many aspects of this aren't already normal practice in your facilities and your laboratories. I think it would be shocking if there was a laboratory running an assay without quality control metrics. But again, it's that also this concept of continual improvement, the ability to garner feedback and then improve not only how that assay is performing. When we think about it, I think we've all run into situations where, for example, if you're resulting out in 48 to 72 hours for your tests, but your customer is walking out the door in 24, or there's opportunity to impact, or that utility ends after 24 hours, the test is operating fine, right? There's nothing wrong with the test per se and its performance. However, that utility then perhaps isn't there, and there's their opportunity for improvement. So a QMS is distinct from, as I think obviously, quality control and quality assurance. Quality control with that effort to detect and correct errors or defective defects in services, as well as assurance, that proactive processes that focusing on prevention of error or defects from occurring. Now, when implementing a quality management system, it ensures that quality management functions, again, fully integrated with the technical and the administrative options of the laboratories. So that helps in, having a structured system that documents all the processes, all the procedures, and notably all the responsibilities. This goes beyond testing person, right? I think testing person always for in front of our minds, but impacts or limitations can come from non-testing personnel, again, administrative considerations. And so we help in meeting requirements of quality policies and objectives that should be documented and established by the laboratories, as well as coordinating and controlling organizational activities. What are the services that are going to be offered? Perhaps, depending on the population, what services shouldn't be offered at? Is everything in-house? Are we going to start doing send-out or distributive models? Obviously, this sort of level of consideration and coordination helps with regulatory compliance, both internal and external assessments of note. And again, whomever those customers might be, the epidemiologists, the clinicians, other laboratories, the CDC, satisfying their requirements and their results, and continually improving to enhance operational effectiveness and efficiency. So quite a few benefits, and I won't go through them all, but I do want to highlight a few because I think recent activities have really brought forefront a couple aspects. Scientific excellence. Public health research clinical laboratories need to uphold a reputation providing medical and scientific excellence. Excellence. The implementation of a QMS certainly helps laboratories maintain positive scientific reputation and ensures that the laboratory science being conducted and resulted is of the highest standard of quality and safety for the practitioner. Customer satisfaction and the improvement of customer satisfaction. Now, quality management does ensure that laboratory patients and customers are satisfied and their requirements are consistently being met. Gaining the patients and customers' confidence and satisfaction is a great achievement that helps enhance the overall reputation of the laboratory. Operational efficiency. A management system increases operational efficiency by improving the use of time and, again, those key resources used by the laboratory. You can connect processes and procedures, and then in such, laboratories are able to turn out planned activities into results. Quicker onboarding is an aspect that comes into mind. Expanding of analytes, another aspect that comes into mind. Reduced review time is something we hear constantly, and that ability to reduce that burden. Over time, these processes and procedures are refined until the laboratory has a system that is effective, efficient, and consistently producing high quality results. Again, this idea of continual improvement. Laboratories can demonstrate a commitment to quality by focusing on continual improvement. Now, this process helps to streamline workflows as well as empowers personnel at all levels. Again, daily practitioners, the testing personnel, all the way through directors to identify opportunities for improvement. And one absolute aspect is that lowering of costs and reducing of waste. So quality management systems are there to, when functioning effectively, cut costs, reduce waste, and decrease the amount of time personnel spend on correcting errors, defects, and reporting of that. Early detection and resolution of issues helps reduce processing and testing errors and decreases the likelihood of releasing of poor quality or incorrect resulting to the customers. And I do want to highlight this. Again, I don't think that this is surprising at all, but there is an absolute cost. And I think it is well published, well recognized to quality. And that is some of the benefits we talk about the good quality, but also poor quality as well. And I won't go through all of them, but I think we're all aware of reporting errors, the potential for mixed diagnoses, unsatisfied customers, and the inability to have a useful result in a timely fashion. These do have reputational costs. And so these are just external aspect of poor quality. Internal aspects of poor quality also, could come from mislabeled specimens, data entry errors, having to test and retest. And then additional time and money spent in analyses of failures and non-conforming events. When we then turn towards good quality, I think it becomes immediately more appreciable that when we do go through things like the planning and the training, preventative maintenance, apologies, these then lends themselves naturally to internal audits, external audits, inspections, and then the assistance and with the competency assessments. There's absolutely, I think, without question, recognition of what this cost is, and so across the board, there's opportunities for facilities at every level for improvement. So it's been very, very, I think, high level. But what we do want to leave with is some operational. So there is many opportunities to improve quality, and then this has been published on. What we want to do is just highlight on a couple of emerging concepts, and that is that there's the opportunity to use, for example, clinical laboratory standards institutes. They have a framework based of a quality management system based on their 12 QSEs. There's American Society for Quality. They also have a framework, appreciable, and there's parity. And that's where I think what we're trying to get across here is whether it's 12 QSCs organized in terms of the resources, the work, and then the evaluation, the QA, and the improvement, you see quite a bit of parity when we think about quality manuals that speak to not only many aspects of laboratory resources, the procedures and instruments and process management. So we can start to see that there are fundamental approaches to how quality management should operate, but there's also the ability for the institutions. It's not just this cookie cutter situation anymore. We have to take and say, oh, I have to absolutely conform to all these elements. There's opportunities to customize it for laboratory implementation. So laboratories need to consider the standards that, whether that's CLSI, or whether that's accrediting organization or similar, that meets their objectives, that meets their needs, encompasses the services that they want to provide or that perhaps are already providing, and the products. There are structures to aid in development and the continuous improvement of quality management system that really center around that concept of you design it, you build it, you deploy it, then the control, and then the continual improvement. When is it the opportune time? Well, there are many changes that occur when regular laboratory operations that can impact quality. I think the key time is when you're standing up a new laboratory, perhaps when you're expanding the discipline or the specialties your laboratory is testing for, otherwise expanding operations, or then maybe onboarding or moving to a new facility or standing up a clinic, bringing on new instruments or new methods, modalities, changes in kits, changes in existing testing processes. And so all opportunities to either re-evaluate your quality management system, or if it's the opportune time, then perhaps establish a quality management system. Now, laboratories do need to consider the policies that are going to be outlining their systems. This includes the overall responsibility of the appropriate laboratory personnel and what those responsibilities are. Again, laboratory activities is what's the testing going to be doing? What's the research? Are there considerations for is it surveillance and outbreaks, or is emergency responses? What's the inventory? This needs to include technical and quality management requirements. What are the requirements for internal audits? What are the requirements for external audits? Certification, accreditation come to mind. You want to ensure that this meets applicable regulatory, local, federal, state, and otherwise requirements. And then again, has this policy includes continual improvement. Now, a QMS policy should also provide flexibility for laboratory personnel to select a suitable structure for their intended use. And there is existing national or internationally recognized standards to build upon that we've mentioned. And that meets all standards, that meets the standard applicable regulatory and accreditation requirements. Laboratories can also customize, again, these recognized standards to align with their practices. Now, a customized QMS would need to meet, again, laboratory-specific regulatory and accreditation requirements towards that goal of that final system must have the flexibility to pass external audits. Now, it should also include active participation on the part of laboratories, executive management, and administrative director, medical director, managers of perhaps multiple specialties, and the supervisor of each laboratory discipline is vital to establishing and maintaining this quality culture and driving personal engagement. So this speaks to that expectation that quality is foundational. Part of that foundational aspect of quality is, does it meet with the ethical principles and practices of the laboratory operations and the facility that's operating within? And those may vary between facilities. Again, this was spoken to earlier, but it's worth highlighting that it's all aspects of the laboratory personnel, senior leadership, managers, supervisors, testing personnel, really need to not only have the expectation that quality is foundational, but when we think about key steps for a culture of quality, is buy-in, and what does that look like? Is it a posting of the quality policy? Is it a posting of the laboratory mission? Is it asking for feedback of those? Again, building a culture is perhaps more than just a printed document. Again, there might be areas that are exempt from aspects of the quality management system. Those should be discussed financial management, for example, and then we talked about active participation. So there's, again, a laboratory's quality policy really is intended to define the culture of quality. The customers, again, remember those are that focused intent. What is the standard of service and the commitment to professional practice, quality services, and compliance need to be clearly stated within the quality management system and also the policy, and the commitment to compliance with applicable regulatory requirements. So that absolutely has to be that buy-in and that support when it comes to audits. An incorporation into the laboratory's quality manual and other processes. It should be a well documentation of the scope, again, of what the laboratory will be providing, all the scope of services, and then how they're going to meet the expectation and needs of the customer. Documentation. The quality management system should have the policies, processes, procedures, and forms, all the physical aspects of it, as well clearly defined roles and responsibilities. I mean, that always towards that opportunity, and provide ample opportunity during the reviewing of testing processes, and the path of the workflow for improvement. So I won't go through this because of time constraints, but again, we do want to just provide some examples of there's multiple opportunities for not only the delegation, but that buy-in. So some things can be delegated, but I don't think buy-in can be. And so from the laboratory director, the supervisors, it is not only the establishment of a quality culture of quality, but what are those practices that are going to be done to go ahead and buy in. And so I think, and I do want to just end with if there's any changes from that initial aspect of when we asked this poll the first time. Are we all at C? Have we changed to A, Bs, or perhaps we're down at Ds? So I do want to thank everybody, and then we alluded to some, but just a selection of quality management standards and guidance. And we spoke about CLSI, but there's where with the ISO and the International Organization for Standardization, WHO, putting organizations like the CAP, and I think we'll CLIA. All right, and I'll end and hand it over to Sabrina.
All right, so once again, thank you, Diego. We just heard about the importance of evaluating the quality improvement plan in your laboratory. Now let's take a look at evaluating the risk management process. And I can also start my video. Okay, there we go. Now let's take a look at evaluating the risk management process. We know that both are equally important and that you should not have one without the other. The quality management process should be used to mitigate risk, and your risk management should be used to improve quality. There we go. When evaluating your risk management process, we know that that is important. Risk management is the process of identifying and controlling risk in an organization. This involves managing policies, procedures, personnel, and resources needed to implement, monitor, and improve your organizational risk management. In your laboratory, your risk management strategies are used to prevent unexpected events that could harm employees, cause damage, or disrupt the operations. In order to create a safe environment, it is important to integrate risk management into daily laboratory operations. This includes regularly identifying hazards, prioritizing any risk, and establishing protocols that mitigate those risks. Now, when you think about your risk management, it should be a collaborative process, meaning it should involve individuals with different skill sets within the organization. It should involve supervisors, investigators, scientists, technicians, as well as safety personnel. The most important people in this process are those who work in a laboratory because, of course, they know the hazards, they know the procedures that are involved, and they know the processes, and they can evaluate the effectiveness of the risk management strategy that you've developed. You want it to be dynamic. Dynamic meaning it should encompass it should implement all operations, protocols, and activities. It should be flexible and able to and be adaptable to any changes in the environment. Continual. The risk assessment and risk management process should be conducted on a continuous basis, especially when there are unexpected changes in the workplace, environment, any policy changes, or if there are procedure changes. Another important aspect is documented and communicated. That should be done in a standardized way so that everyone understands the objectives, any goals, any challenges, and the benefits of the risk management strategies. Now, your risk management involves assessing, mitigating, and performance, which we may have seen this, also known as the AMP model. When you're assessing, your assessments. So let's consider this the first step where risks are identified and evaluated. That involves analyzing any potential hazards, understanding the likelihood and impact, and determining the level of risk. You'll also take a look at mitigation. Mitigation is, so once you've identified whatever that risk is, the next step is to develop strategies to reduce or eliminate them. Now, this may involve implementing safety measures, improving processes or procedures, or it's something like providing training to your staff. And performance. So after implementation, your risk management, after implementing your risk management strategies, you should monitor and evaluate their effectiveness. Regular performance checks ensure that implement measures are working as you intended them to. Now let's take a look at something that's very common, such as the risk of slips and falls in your workplace. Here's an example of how the AMP model can be applied. You assess. So we walk through the workplace, we identify potential hazards that could lead to slips and falls, such as if there's a wet floor, uneven surfaces, or if there's clutter that you've noticed. We evaluate the likelihood and the severity of any risk that could result of the things that we just identified. Then we take a look at mitigation. Based on our assessment, we implement measures to mitigate the risk. This may include installing non-slip mats, making sure there's proper lighting, or placing warning signs near the wet floor areas. And performance. To ensure that there's effectiveness of the risk mitigation efforts, you need to regularly monitor and evaluate the performance. Now, this involves conducting inspections to check for any new hazards or any maintenance issues, reviewing any incident reports, and you also want to seek feedback from the employees regarding any safety concerns that they may have noticed. Now, what we've seen is that following the AMP approach and risk management for slip and falls, you can continuously assess the risk, implement measures to mitigate them, and regularly monitor the performance, because you ultimately want to maintain a safe working environment. So when we take a look at risk assessments, we know that they are the foundation for safe laboratory operations, and that conducting a risk assessment should be viewed as a systematic process that's used to help you identify the hazardous characteristics of an infectious or potentially infectious agents, the likelihood that such exposure will cause laboratory-acquired infections, and the probable consequences of acquiring an infection. The information that you identified in the risk assessment that you've conducted will provide a guide that is simply your guide to help you make the appropriate or take the appropriate mitigation steps. Now, your risk assessment also evaluate what could go wrong in certain situations and consider what steps are required to reduce those risks to an acceptable level. And by assessing our risks, we make informed decisions and take appropriate actions to ensure the safety of individuals, protect our assets, and minimize any negative impacts. And we know risk assessment, like we said, build the foundation for the overall risk management strategies. Now, we know facilities should have a policy and process in place for conducting activity-specific risk assessments. The risk assessment policy should outline the principles of your risk assessment, which includes identifying your hazards, analyzing your risk, and you want to also prioritize your risk. It also explains how the assessment will be documented and communicated to all staff members. Once you establish that policy for your risk assessment, that describes, the policy describes how risk assessment influences the implementation of control measures and performance management. So in other words, this is very important to remember. Your risk assessment should be proactive rather than reactive. And the results of the risk assessment should be reported to senior management. So now that you've received all this information about risk assessments, I know you're asking yourself, when should I conduct a risk assessment? Well, here are some of the major points when you should conduct a risk assessment, right? Anytime you're starting new work or making changes to the program of work, such as you're introducing new biological agents, that would be a time when you should conduct a risk assessment. If you have any modifications to laboratory equipment, any operations within a facility, or if you have new construction. And also when you have change in staff, that should be another opportunity for you to step back and take a look at your risk assessment to make sure all of your processes and procedures are working effectively. Now we will have a poll here, and it keeps jumping, but we do have a poll here just to do, this is a pulse check. So the poll question, risk assessments are conducted and reviewed, and you choose the answers that are correct. When there are significant alterations to the standard operating procedures, when unexpected events that may have relevance for the management of biorisk are observed, as part of our existing management system review process, example, something that we do on an annual basis, or D, if you do it right the first time, then you should never, ever have to do it again. So we do have a couple of responses, and I'll give you all just another second or two. But like I said, I threw this in just as a pulse check, and spoiler alert here, the answers are A, B, and C. Of course, D, we want to drive home that, of course, you want to do your risk assessment right the first time, but it is one of those things that you should continuously do over and over. Thank you all for participating in the poll. We'll move on to the next slide. All right, so let's take a look at risk mitigation. And it just keeps moving on its own. Well, let's take a look at risk mitigation. Risk mitigation is designed to eliminate or mitigate your risk to an acceptable level. Now, this is usually done through a formal or an informal process to ensure that procedures in place are significant to manage the risk associated with the safety and well-being of the laboratory workforce. Leadership must acknowledge which risks are acceptable and what control measures are in place. And, we know that no two organizations are alike, and not every organization will make the same decision about which risks are acceptable. So this decision is based on the organization's tolerance of risk and also the availabilities of resources to manage the risk at each facility. Now, here are some examples of mitigating risk when you're evaluating your process in your facility. You want to ensure that equipment is regularly inspected, maintained, and calibrated, which this can help to reduce the risk of accidents or errors caused by faulty equipment. You want to also take a look at staff competency levels. They should be documented and maintained to show that all personnel handling biological agents and toxins are competent in performing good microbiological techniques. Let's say your facility conducted a risk assessment and you determine that staff competency training could be improved. So we know that inadequate training of our staff that could lead to unsafe practices in the laboratory. So here are a few strategies that can be implemented to mitigate the issues of inadequate staff competency and enhance training effectiveness. One, you can develop a comprehensive training program that encompasses both theoretical and practical aspects, which that should ensure that all necessary skills and knowledge are covered. You could offer ongoing professional development opportunities such as workshops, seminars, or online courses to keep staff updated on the latest techniques, technologies, and any safety protocols that have changed. You could implement mentorship and shadowing programs to place less experienced staff with seasonal colleagues. Now, this will provide hands-on learning opportunity, guidance, and it will also support in developing skills and additional competencies. And you can also ensure the training program incorporates feedback mechanism where you have written documentation of all training activities and regular retraining or competency testing of the staff. And it's important to provide laboratory professionals with sufficient information, resources, as well as time to develop good habits. So here we'll take a look at performance evaluation. Performance evaluation ensure mitigation strategies have reduced risks to an acceptable level. We wanted to continuously evaluating performance, demonstrate the risk management system's success, and it helps identify where it needs to be improved. Some activities you can consider that you should consider and that are involved in the performance evaluation. If there's any findings during an inspection report during an inspection, that you act on those findings. You want to monitor controls as well as collect data from the controls you're monitoring. You want to report and evaluate results to leadership as well as to personnel that are working in the facility. Now, it's important that everyone is responsible for actively monitoring and evaluating the performance of the chosen controls. When monitoring the controls, you want to review mitigation strategies to identify what performance indicators should be monitored for each control measures. Now, here are some methods that could be used to collect data on performance. If you do audits within your laboratory, you want to constantly review the training records to ensure that they are adequate. You can take a look at incident or inspection reports. The results from the data monitoring should be used to evaluate the effectiveness of the implemented control measures. Your evaluation should be routine and continual. And it's also important at this point that you want to encourage open lines of communication so that from any of the findings or if there's any information that you've noticed from the inspection report, that staff or everyone have an opportunity to feel comfortable reporting that information. All right, so this is our second pulse check for this section. Now here I want you to select the best answer. Which of the activities below are involved in performance evaluation? The options are A, acting on the findings, B, conducting the initial risk assessment, C, monitoring controls and collecting data, D, determining whether the risks are acceptable or unacceptable, and E, reporting and evaluating results. So just a few seconds here. I see the results are coming in. And thank you all who are participating. And the correct answer is winning by a lot. So I'll go ahead and let you all know because I know you're just dying to hear the answer. So the answer is A, C, and E. and we had 45%. Thank you very much. And I will go to the next slide. All right, let's talk about communication. We know communication is an integral part of risk management. It plays a critical role in effectively identifying, assessing, and mitigating the risk in the laboratory. Risk communication serves to educate others about the risk and it can actually help change attitudes. Good risk communication helps to alleviate fears regarding risk, or inversely, it can also help demonstrate that the risk is unacceptable. Risk communication should be part of a structured risk management process. So for this section, in summary, or in conclusion, your risk management is essential for the success and sustainability of any organization. It involves identifying, assessing, and mitigating potential hazards and risks within the laboratory environment to ensure the safety of the personnel, the environment, and also ensure accurate testing outcomes. Evaluating your risk management process should be ongoing, and it should be adaptable. Embracing a proactive approach when you're evaluating your risk management system will ultimately lead to a more resilient and a safer future for the organization. So on this screen, here are some of the resources that have been developed and are available through the Division of Laboratory Systems to assist you in implementing and evaluating your risk management in your laboratory. And I want to say thank you on behalf of Diego and myself. We appreciate you listening to our presentation. Thank you.
Thank you. We'll take a few minutes and answer as many questions as possible. Again, if we don't answer your question today and you have questions later after the sessions, please feel free to email the OneLab inbox at onelab@cdc.gov. Let's see what we have. Okay, right now we just have one question. And this member wants to know, they want to thank you both as presenters, and they would like to know, could you please share how your backgrounds, education, degrees, and passion led you to the field of quality and safety? I guess, Diego, you can go first.
Well, I was just gonna say, Sabrina, go ahead, because I think you're ready.
Oh, yes, I can go first. I'm sorry, Alicia, repeat that question. There were so many pieces to it.
Yeah, they would like to know, like for you to share how your background, education, your degrees, and your passion led you to the field of quality and safety.
Background, I have a master's in forensic chemistry, forensic biology, a doctorate in health science. Came to CDC about 21 years ago, started as an inspector in a regulatory branch of CDC, and I've just been in this field for the last 21 years, and it's just involved into, staying connected with the laboratory community, as well as now the branch that I'm in, we have that, we work with clinical and public health labs, and over the last 20 or 21 years, it's just my passion for working with the labs. It just, keeps evolving, and I'm constantly learning from them and they're learning from me, but it's just being in a field where you feel appreciated and valued, and it's constantly evolving. And I feel like everyone is learning at the same time. So yeah, that's my background.
Okay.
Diego, you're up.
Oh, thanks, Sabrina. So I kind of a relatively late joiner to a CDC. I did a lot of graduate work more in biotechnology, trying to learn about evolution of protein interacting domains and the way they evolve. They use it for protein engineering, and then bacterial surface display. The point being is I spent quite a bit of time in more like a biotech applied applications. And so I think it's seeing test development through test deployment and getting that actually approved and out the door into people's hands. I think was an interesting aspect. I think I was lucky to see that from more of a developer side, and then coming to public health and seeing that impact. And then I did a stint in the kind of interagency space during COVID. Always interesting times during COVID. I think the ability to then take what is being used to result a test, and then how it impacts and informs policy decisions all the way up to the White House. Kind of led me to the space of how to improve those aspects. And then, as Alicia mentioned, I help with next generation sequencing technologies, and then particularly with getting those method validations through and improved in both public health and clinical applications, and we'll kind of deep dive into genomics. So a long way of saying is just that practical application of test development is fantastic, but getting it out the door and useful is I think really an interesting passion. Oh.
Thank you. This question is for Sabrina. When you do a risk assessment, do you use one unified form, or do you use forms specific for specific situations, such as a different form for changes to procedures, injury, potential exposure, new equipment, etc.?
All right, so I will say there's no one unified form for risk assessments, what we found. And this is the field that always says it depends. So as far as a risk assessment, it depends on your institution. You can develop a risk assessment form for if you're getting new equipment. There's so many different resources online, but I can say it will depend because there is not just a one specific risk assessment form. It does depend on the situation and the actual institution.
Thank you. Well, that seems like all the questions we have for this session. I'll give it a few minutes to see if one pops up. Let's see one. So I'll say thank you, Diego and Sabrina, for your commitment to safety and quality of clinical and public health laboratories.
Thank you for having us.
You're welcome.
Okay.
We'll pause for a few minutes before the networking session that begins at 1:35 p.m. Please use the link that's in the chat to join the session, where you can connect with your peers and exchange ideas. We'll see you over in the network section.